RPR test. Both these tests we do for syphilis. So syphilis is caused by which organism causes syphilis? सिफिलिस कौन सा ऑर्गेनिज्म कॉज करता है? ट्रिपोनिमा पैलिडम। वो क्या है? बैक्टीरिया है, वायरस है, पैरासाइट है, फंजाई है, क्या है? बैक्टीरिया। ठीक है। So both the VDRL and RPR test, it works on the principle of precipitation reaction. So what does the precipitation reaction says? When a soluble antigen reacts with its antibody in the presence of optimal temperature, pH, electrolytes, it leads to the formation of antigen-antibody complexes in the form of insoluble precipitation band or insoluble flocules. So this here you have to remember one thing. In precipitation reaction we use the soluble antigen, and when you will be knowing about the agglutination reaction, in agglutination reaction we use insoluble antigen. Okay, so precipitation reaction we apply it in this principle of precipitation reaction we apply it in the slide flocculation test. Okay, and VDRL test and RPR both are examples of slide flocculation test only. Now coming to the principle of principle I have said. Now coming to procedure of VDRL. So VDRL में हम लोग क्या करते हैं, ये एक स्लाइड लेते हैं, इसमें बहुत सारी कॉन्केविटीज़ होती हैं। यहाँ पे जैसे तुम लोग गिन सकते हो 12 कॉन्केविटीज़, मतलब डिप्रेशन है। ठीक है, तो इसको बोलते हैं VDRL टाइल। अभी क्या करते हैं हम लोग, इसमें जब तुम लोग VDRL करने के लिए किट लोगे ना, उसमें तुम्हारा एक रिएजेंट होगा और उस रिएजेंट पे मेनली तुम्हारा कार्डियोलिपिन एंटीजन होता है। एक तुम्हारा पॉजिटिव कंट्रोल होगा, एक नेगेटिव कंट्रोल होगा। तो उस प्रोसीजर में तुम पहले मान लो कि एक पॉजिटिव कंट्रोल ले लिया, एक नेगेटिव कंट्रोल और एक टेस्ट के लिए ले लिया। ठीक है, अभी इसमें पॉजिटिव कंट्रोल का सैंपल डालोगे जो ऑलरेडी है, उसमें एक पॉजिटिव कंट्रोल, एक नेगेटिव कंट्रोल और एक में पेशेंट का टेस्ट सीरम डालोगे। अब टेस्ट सीरम जो है वो हीट इनएक्टिवेटेड होना चाहिए। हीट इनएक्टिवेटेड का मतलब जो तुमने पेशेंट का सीरम लिया है उसमें एंटीबॉडी, VDRL और RPR दोनों टेस्ट ही हम लोग पेशेंट के बॉडी में एंटीबॉडीज़ को डिटेक्ट करने के लिए करते हैं। ठीक है, तो जो सीरम ले रहे हो तुम लोग, उसमें एंटीबॉडीज़ के अलावा बाकी प्रोटीन्स भी होते होंगे, हार्मोन वगैरह और भी बहुत कुछ। तो बाकी सबको इनएक्टिवेट करने के लिए हम लोग वो जो टेस्ट सीरम लेते हैं ना, उसको हम लोग हीट करते हैं। तो और ये याद रखना है, जो RPR में हम लोग पेशेंट का सीरम लेंगे ना, उसमें हम लोग उसको हीट नहीं करेंगे, क्योंकि जो तुम VDRL में जो रिएजेंट ले रहे हो ना, उसमें तुम्हारा कार्डियोलिपिन एंटीजन है, और जो RPR में तुम लोग रिएजेंट लोगे उसमें तुम्हारा कार्डियोलिपिन एंटीजन एलोंग विथ चारकोल पार्टिकल्स भी रहेंगे। जो चारकोल पार्टिकल्स रहते हैं RPR में, वो तुम्हारा मतलब कि एक स्टेबलाइज़र की तरह एक्ट करता है। तो इस वजह से तुमको बाकी सब कुछ को इनएक्टिवेट करने की मतलब वो जो है वो मतलब कि एज ए स्टेबलाइज़र काम कर देता है, इसलिए तुमको उसको हीट नहीं करना पड़ता है। ठीक है, और हम लोग हीट करते हैं ताकि जो बस खाली एंटीबॉडीज़ रहे उसमें, और ताकि वो जो एंटीबॉडी और एंटीजन का रिएक्शन हो वो अच्छी तरह से कैरी आउट हो जाए। अभी इसमें तुमने पॉजिटिव कंट्रोल डाला, एक में नेगेटिव कंट्रोल और एक में पेशेंट का टेस्ट सीरम लिया, और इसमें अभी जो पॉजिटिव कंट्रोल लिया है उसमें तुम डालोगे पेशेंट का नहीं, जो तुमने रिएजेंट बोला था ना जिसमें खाली एंटीजन होता है, कार्डियोलिपिन एंटीजन, वो एक पॉजिटिव कंट्रोल में डालोगे, एक ड्रॉप तुम नेगेटिव कंट्रोल में डालोगे और एक पेशेंट के टेस्ट सीरम के साथ मिक्स करोगे। तो जो पॉजिटिव कंट्रोल है उसमें हमेशा तुम्हारा मतलब कि जो फ्लोक्यूल्स है वो आना चाहिए और जो नेगेटिव कंट्रोल में उसमें नहीं आना चाहिए। चाहे जो टेस्ट वाला सैंपल लिया है ना, चाहे तुम्हारा टेस्ट पॉजिटिव हो नेगेटिव हो, लेकिन पॉजिटिव कंट्रोल में हमेशा फ्लोक्यूल्स आना चाहिए, नेगेटिव में नहीं आना चाहिए। अब पॉजिटिव कंट्रोल और नेगेटिव कंट्रोल लेने का इम्पोर्टेंस क्या है? इम्पोर्टेंस ये है कि जो टेस्ट की मतलब क्या बोलते हैं, ताकि जो टेस्ट है वो एक्यूरेटली कैरी आउट हो जाए, मतलब उसकी वैलिडिटी चेक करने के लिए, और ताकि कुछ फॉल्स पॉजिटिव या फॉल्स नेगेटिव रिजल्ट्स हमें ना मिले, ताकि टेस्ट जो है वो एक्यूरेटली हो जाए। ठीक है, इस वजह से लेते हैं। अब तुम जो ये तुमने पॉजिटिव कंट्रोल नेगेटिव कंट्रोल टेस्ट सीरम लेके एंटीजन डाल दिया सब में। अभी जो ये स्लाइड है इसको तुम लोग VDRL शेकर के ऊपर रखोगे। इंस्ट्रूमेंट जब पढ़ाया था तब देखा था ना VDRL शेकर, तो उसमें रख के उसको 120 रोटेशंस पर मिनट अप टू 4 मिनट्स तक तुमको उसमें उस मशीन में रोटेट करना है, ताकि जो यहाँ पे सैंपल डाले हैं ना वो सारा अच्छे से मिक्स हो जाए। फिर तुमको अगर तुम्हारा टेस्ट पॉजिटिव आया तो ऐसे फ्लोक्यूल्स देखने को मिलेंगे। अगर ऐसे लूज क्लम्प्स मिला तो मतलब ये वीकली रिएक्टिव है। अगर ऐसे टाइट क्लम्प्स मिले, ऐसे वाले सबको दिख रहा है ना, मैं टाइट क्लम्प लूज क्लम्प क्या बोल रही हूँ, ऐसे लूज क्लम्प्स अगर दिखे तो मतलब ये वीकली रिएक्टिव है। अगर ऐसे टाइट दिखने को मिले मतलब ये स्ट्रांगली रिएक्टिव है। और कुछ भी अगर फ्लोक्यूल्स फॉर्म नहीं हुआ हो मतलब ये नेगेटिव है, रिएक्टिव नॉन रिएक्टिव रिएक्शन हुआ ही नहीं है इसमें। ठीक है, हाँ ये तो हो गया। हाँ, तो प्रोसीजर समझ में आया, रिज़ल्ट कैसे देखना है वो भी समझ में आया। अभी देख लो, जो ये हम लोग VDRL और RPR करते हैं ना, ये एक क्वालिटेटिव टेस्ट है। ठीक है, मतलब इससे तुमको ये पता चलेगा कि जो टेस्ट है हाँ रिएक्टिव है, पॉजिटिव है, नहीं है। अभी जो तुम लोग एंटीबॉडीज़ डिटेक्ट कर रहे हो, अब एंटीबॉडीज़ का अमाउंट कितना है, तो उसको क्वांटिफाई करने के लिए हम लोग सीरियल डाइल्यूशन करते हैं। सीरियल डाइल्यूशन वाला पार्ट पूनम मैम तुम लोग को पढ़ा देगी अभी। और यहाँ पे जो ये पिक्चर दिख रहा है ना, ये सीरियल डाइल्यूशन करने के बाद का रिजल्ट है। ठीक है, अभी प्रोसीजर हो गया, रिजल्ट भी हो गया। हाँ, अभी VDRL का यूजेस देख लो। स्क्रीनिंग एंड डायग्नोसिस ऑफ सिफिलिस के लिए करते हैं। मॉनिटरिंग रेस्पॉन्स टू द ट्रीटमेंट, मतलब पेशेंट तुम्हारा जो ट्रीटमेंट के ऊपर उसका रेस्पॉन्स कितना है नहीं है। अगर पेशेंट का टेस्ट करोगे तुम, मान लो कोई पेशेंट ट्रीटमेंट रिसीव कर रहा है, तुम कुछ दिन बाद उसको बुला के उसका टेस्ट करोगे। जब अगर उसके बॉडी में एंटीबॉडीज मतलब डिक्रीज होता हुआ दिखे, मतलब पेशेंट इज रेस्पॉन्डिंग टू द ट्रीटमेंट ना। स्क्रीनिंग इन एंटीनेटल केयर, प्रेग्नेंट फीमेल्स के लिए भी करोगे ताकि बेबी के ऊपर वो ट्रांसमिशन ना हो। बाकी डायग्नोसिस ऑफ न्यूरोसिफिलिस, क्योंकि VDRL टेस्ट जो है वो तुम ब्लड के अलावा CSF में भी कर सकते हो। और ये याद रखना है कि जो तुम पेशेंट का जब तुम ब्लड लोगे एज ए सैंपल, ठीक है, तब उसको तुम हीट करोगे, और जब तुम CSF लोगे एज ए सैंपल तब उसको तुम हीट नहीं करोगे। ठीक है, और स्क्रीनिंग ऑफ ब्लड डोनर्स, ब्लड ट्रांसफ्यूशन करने से पहले हम लोग इसका टेस्ट करेंगे। VDRL हो गया। हाँ, अभी RPR में आ जाओ। RPR का भी प्रिंसिपल सेम ही है, प्रेसिपिटेशन रिएक्शन जैसा बस, और प्रोसीजर भी सेम ही है, एक्सेप्ट कि तुम जैसे VDRL में एक ऐसा स्लाइड ले रहे हो ना, लेकिन RPR में तुम ऐसा एक कार्ड लोगे। ठीक है, ऐसे कार्ड में ऐसे राउंड रेड कलर के ऐसे सर्कल्स बने होंगे, और इसी में तुम लोग सैंपल डाल के सेम। बाकी जहाँ VDRL पे तुम लोगों ने वो VDRL शेकर यूज़ किया था इस रोटेट कराने के लिए, इसमें शेकर यूज़ नहीं करना है। बाकी रोटेट भी इसी को मतलब 120 रोटेशंस पर मिनट ही कराना है। VDRL में 4 मिनट्स तक के लिए कराया था, RPR में 8 मिनट्स तक कराओगे, डबल हो जाएगा टाइम। और यहाँ मैंने बोला ही था कि RPR में जो तुम लोग एंटीजन ले रहे हो ना, मतलब जो पॉजिटिव कंट्रोल नेगेटिव कंट्रोल के साथ एक रिएजेंट ले रहे हो, उसमें कार्डियोलिपिन एंटीजन प्लस चारकोल पार्टिकल्स होता है, और चारकोल पार्टिकल्स के वजह से तुम्हें यहाँ पे ब्लैक कलर के प्रेसिपिटेट्स देखने को मिल रहे हैं। ठीक है, तो ये देखो, ये रिएक्टिव का सैंपल है, और ये जो दिख रहा है ये नॉन रिएक्टिव है। और हाँ, एक और डिफरेंस, जो VDRL टेस्ट है उसको तुम पूरा प्रोसीजर कराने के बाद माइक्रोस्कोप के अंदर तुमको वो फ्लोक्यूल्स देखने को मिलेंगे। बाकी RPR में तुम लोग ऐसे मतलब बिना माइक्रोस्कोप के भी देख सकते हो, खुले आँख से। बाकी हाँ, अभी RPR और VDRL के बीच का डिफरेंस, RPR तब करना है जब सैंपल लोड कम हो, VDRL तब करना है जब सैंपल लोड ज़्यादा हो, और RPR तुम बस ब्लड के लिए ही कर पाओगे, बाकी VDRL ब्लड और CSF दोनों के लिए कर पाओगे। RPR कंपेयर टू VDRL ज़्यादा एक्सपेंसिव होता है और कंपेयर टू VDRL ज़्यादा मतलब फास्टर रिजल्ट्स भी दे देता है। बस इतना ही पता रहना चाहिए। किसी को कुछ डाउट है, कुछ नहीं समझ में आया, बता दो। ठीक है।
Reaction will be an antigen antibody reaction. I said agglutination reaction. Yeah. Apart from that, in microbiology, precipitation का बता दो, मैम ने पढ़ाया अभी precipitation. What are the example of precipitation test? VDRL and RPR. Okay. So in agglutination, we will mainly focus on the Widal test and sometime ASO and C-reactive protein test. Okay, C-reactive protein test, ASO and Widal test. So what is the definition of agglutination? What is the difference between precipitation and agglutination? Basic difference. यहाँ पे देखने से कुछ नहीं होगा. Leave it. Basic difference. Okay. And in precipitation? Settling. This is called floccules. The basic difference is the antigen and there will be antigen antibody reaction. The antigen will be in precipitation, it will be soluble. In agglutination, it will be insoluble. Okay. Okay. What are the types of agglutination then? Class लिया है ना? Class हुआ है क्या? Okay. Agglutination is again of three types. Okay, direct agglutination, indirect or passive agglutination, and reverse passive agglutination. So in direct agglutination, what happens? Direct, antigen antibody reacts, agglutinates formation, agglutinate forms. That's a direct one. Indirect or passive? See, in indirect or passive, we are trying to convert the precipitation reaction into an agglutination reaction. So what will we do? Huh? Yeah, we will, no. In agglutination, we add insoluble particles. Na? Why insoluble? Why there is clump formation? Can anybody tell me why there is clump formation? Yeah, in precipitation also antigen antibody reacts. But there is floccule formation. Floccule formation in the liquid media, and in gel media, band formation. Okay. So why there is agglutinate or agglutinate formation? What is the reason? Have you, did you did anything about ESR test? ESR, a sedimentation test. What was that? What was there? Yeah, what was that?
Rolex formation.
Yes, why there is Rolex formation? And what is that Rolex formation?
In the stack of RBCs.
That is clumping of the RBCs. Same, there will be either clumping or aggregation together, aggregates together. That's why making it visible, more visible. Why? Achha, agglutination is what type of test? Is it quantitative or qualitative? What type of test is this? Huh?
Qualitative.
Yeah, precipitation. Achha, what is better? Precipitation or agglutination? Which one is better? Yeah, agglutination. Why? Why?
Because it's insoluble.
Yeah, it's insoluble and it's more visible. That's why. Okay. So, I said in reverse, indirect or passive, we are converting the precipitate reaction into an agglutination reaction. How? We are adding a carrier molecule to it. Okay. It can be either RBC or latex. These are the two things which we add. So, direct is again of three types, either slide agglutination, tube agglutination, and the third one is microscopic. Okay. In slide, we basically we do the reaction in the slides, okay, or in the card. In tube, we do it in the test tubes. And microscopic, we use the micro titer plate, okay. Last one was the reverse passive agglutination. Okay, in passive agglutination, what we were detecting? Either antigen or antibody, any of the one, na? Which one we were detecting? Yes, antibody. In passive agglutination, we are detecting the antibody in the serum of the patient serum, antibody. But here in case of reverse passive, we will detect the antigen. Okay. So same way, we are converting the precipitation reaction into an agglutination reaction, but the carrier molecule will be antibody. We will put a latex or anything to the carrier molecule, which is the antibody. Okay, latex and RBC will be the carrier molecule, and the antibody will be coated over it. Okay, yeah, antibodies are coated with the latex molecule. Anything can happen. Okay, so we have antibodies. We will detect the antigen. Okay, fine. You got it now. So, apart from this, what else is the basic difference between agglutination and precipitation? Time related, anything? Which one takes more time?
Precipitation takes.
Precipitation takes more time. Why?
Because it's time to form the molecules and quantity.
Which, what is the size of the soluble particles in case of agglutination? Size, is it smaller or larger one? Yeah, it is smaller. Okay, it is smaller. In agglutination, the particles are smaller, whereas in case of precipitation, the particles are larger. That's why there is flocule formation. What is that flocule you can see? What is chalky white color, fluffy thing that you see? That is flocules. Okay. Okay. So as I mentioned before, in agglutination we will mostly look for the Widal test. Why we do the Widal test? For what? Yes. What is the microorganism responsible for it? Salmonella typhi and Salmonella paratyphi AB. Fine. Apart from that, what else reaction? तुम बताओ, देख के बताओ, खुशमिता. What apart from that, और कौन सा टेस्ट है बताओ, देख के बताओ.
Antiglobulin test, typhus fever, real Felix reaction, infectious mononucleosis, Paul Bunel test.
Okay. So can anybody tell me what is that COMS antiglobulin test? ये तुम लोगों ने physiology में पढ़ा होगा. COMS antiglobulin test.
It is used for the detection of RH
Yes, RH incompatibility. Very good. Okay. You go through it. You learn it little bit. That's fine. Okay. Let's come. Can anybody give me a copy? Note copy. ठीक है, ये दे दो. So I want. What's funny? तुम हमेशा मैं देखती हूँ तुम you are always laughing or something. I don't know what's funny about in the class. I don't get it. What? Okay, focus. Suppose these are the test tubes. Okay. Let's say we are doing the Widal test. Okay. The test that you are doing, first test that you're doing in case of serology test, this will be either it will be qualitative or quantitative. Which one will it be? Qualitative or qualitative? So what do you see in the qualitative? You're just detecting. Yes. Yeah. Positivity is not. Positive is there is not. That's what you detect. If the test is positive, we will go for the quantitative. Okay. What we are trying to get there in quantitative?
Amount.
Yes, amount. So Widal test is directly a quantitative test. It's directly a quantitative test. Okay. So we will do for quantitative, we always go for serial dilution. The most important thing is serial dilution. So suppose these are the test tubes. One of them is control. Okay. We will keep it aside. There will be number of test tubes. No matter how many number of test tubes with a control at the last. We will keep a control at the last. Okay. In the first test tube, we will add 1.9 ml of NS. Why we are adding NS? Normal saline. Why we are adding normal saline?
Not quite yet.
Huh? I said serial dilution. We are diluting something. So we can add distilled water for dilution. Water देने से तो dilute हो जाता है.
To make so that the water doesn't come out from the vessels.
Okay, fine. Keep it. हाँ, हम लोग इस चीज के लिए भी रखते हैं. But dilution means light करना होता है. So we can use distilled water, but we don't use distilled water. Your point is right. Normal saline. Okay, 1.9 ml normal saline. Then we will add. Here we are trying to detect in Widal test. What we are trying to detect, is it antigen or antibody? Yes, antibody. So total serum, patient total serum, we will add. How much is that? 0.1 ml. total serum. So before that, we will add 1 ml, 1 ml, 1 ml, 1 ml, subsequently normal saline for dilution. Okay. So what is the total amount, not concentration, what is the total amount ml in ml? It is 1 ml before, like not 1 ml. What is the total? Huh? I said normal saline is 1.9 and total serum is 0.1 ml. How much? 2 ml. So in the first test tube, we got 2 ml. 2 ml. So can anybody tell me, इस 2 ml में कितना होगा total serum? 2 ml में अगर 0.1 ml का total serum है, तो 1 ml में कितना होना चाहिए? Yes, 0.05. Second step, we will transfer 1 ml to this one. Second test tube. Okay? कितना होगा इसमें? 2 ml. तो इस 2 ml में मेरा total serum कितना होगा? 0.05 था. कितना होगा उसमें सेकेंड टेस्ट ट्यूब में? 0.025. नो इस 2 ml में 0.05 ml है. इसमें से मैं 1 ml में कितना जाएगा मेरा? 0.25. कितना आता है? 0.025. ठीक है. सेकेंड में फिर से मैं ट्रांसफर कर रही हूँ 1 ml. ठीक है. कितना आ रहा है इसमें सेकेंड में? सेकेंड में कितना आएगा? इस 2 ml में कितना आने वाला है? 0.25. कितना आता है? 0.1. ठीक है. 0.101255. ठीक है. So what is titer? What is titer? Titer मैम ने पढ़ा है, मुझे पता है. What is titer? Antibody antigen reaction है. titer नहीं पता. What is titer? What is titer? First question from the examiner. What is titer? You have to say it is the highest dilution at which antigen antibody reacts. Huh? This is titer. Fine. So what is pro-zone phenomenon? What is post-zone phenomena?
Sometimes there is a false negative due to ज़्यादा एंटीबॉडी.
या ज़्यादा एंटीबॉडी होने से प्रोजन फेनोमेना होता है. Okay, there is no reaction. Basically there is reaction, but still we say there is no, theoretically we say there is no reaction. Okay, so that is frozen phenomena. That's after the last dilution at the titer at the last dilution, there is, what is there after that? Post-zone phenomena. Okay, why? What is excess there? What is excess? Is it antibody or antigen? Yes, antigen. Okay, so titer. So first वाले टेस्ट ट्यूब में टाइटर कितना होने वाला है? 1:20. ओके. सेकेंड में कितना वाला है? कितना आएगा इसका? 40. 40. Is it 40? Yes. Second में? Third में? Like that? Okay. Keep your copy. So, see, how will it detect the? अच्छा, what is the titer of this test? What is the titer in this test? What is the titer? Which one is the titer? Last वाला कौन सा टाइटर होगा बताओ? 1:1. Yes, because this is the last where the antigen and the antibody are equal. Okay, that's where the reaction has lastly happened. After that, there is excess in antigen. There was excess in antibody, but there is excess in antigen. So how will you say there is positive reaction? First, there will be carpeting. The highest carpeting. Can you see? There is highest carpeting. This is carpeting. This is the highest carpeting is present. So this is the titer, highest titer. And these are bubble formation, lower. Okay, got it? They clear? So why this is blue color and why this is pink color? No, this is for the type of antigen we are using it. So typhus में typhoid में type का type. What are the types of antigen? Antigen कितने type का होता है? Typhus में? टाइफॉइड में कितने टाइप का एंटीजन होता है? How many types of antigen are there in typhoid? Okay, leave it. You remember the O antigen and H antigen. Okay, the O antigen mein this will be blue, and you will see the okay. In H antigen it will be reddish color. Rest you read from your textbook. Oh, wala. C-reactive protein alone. Okay. So viral test is what type of agglutination test? Viral test?
Quantitative.
Huh?
Quantitative.
Yes, it is quantitative. Apart from that, I said slide, test tube, direct test tube agglutination. Okay. So C-reactive protein is a reverse passive agglutination test. I said reverse. What did I say about reverse passive agglutination test? To find the antigen. What we are adding? Carrier molecule. What is the carrier molecule for that? Here we will use latex. Okay. So any other reverse passive agglutination test you know? ASO test? Acha, viral test. What will be the clinical presentation for this typhoid? What will be the clinical presentation? That's written in your microbiology book. Step ladder fever. One of the thing. Okay. And ASO में क्या होने वाला? What is ASO? Okay, let's not ask you any more question. Okay, let's go direct. So C-reactive protein is a reverse passive agglutination test. So we are trying to detect the antigen. So how will we do? See, we will do it on a plate or slide, okay, or card. Basically, it is card. We will forget about this section. You just keep focus on this one. We will. Is it positive or negative? This one. How will okay. How will you differentiate between the precipitation and agglutination reaction if you got a slide like card?
Now in precipitation there will be flocule.
Yes. Apart from that, how will you differentiate if there is agglutination is present or not? How will you say it is positive or negative? Suppose we are not seeing that much. How will you say that the agglutination is present? How will you say this? We will look under the microscope at objective power. What is the objective power?
100x.
10x is sufficient. Okay. So we will think it is the positive control because since the reaction is there, this is the positive control, this is the negative control, and this is suppose that is control. Why I said this is negative? Reaction hai, but you can see there is color, bluish color. What is this? Milky white color. Okay. When you add the milky white color is because of the latex. Take the latex. That's why there is color. There is reaction. That's why agglutinates or clumps are there. Fine. Fine. That's it. You can move on to NAKSHATRA, sir. I guess.
Safe. These are not the positive ones. You can take a look at this. These are the immunochromatography test. Okay. What does immuno means? Immuno means immunological, okay? Chromato means color and graphy means to read or to find out, okay? So based on the color, if you can see behind you, just look behind you. This is how a immunochromatography test looks like, okay? First of all, immunochromatographic tests will be mainly divided into two types. These are rapid tests, okay? You guys know about rapid tests, na? Rapid tests because they come very rapidly. Within like 20 to 30 minutes, we'll get a result, okay? So there are two types of rapid tests. First one is the lateral flow and the second one is the flow through ones, okay? The lateral flow means that it flows in one direction laterally, okay? This is a sample pad. To those students who have your rapid test, just take this one. You can see that there is one place where you can put in the sample. Can you see this one? Pass on to them, show it to your batchmates. You can see now. Okay. After I put the sample, for example, this place is here, okay? Put the sample, what happens is, there is a pad here, okay? This pad contains colloidal gold particles, nanoparticles, okay? These nanoparticles bind to anything that's present in your sample. For example, if it's a dengue, what will be the sample? Blood, okay? Blood. In case of dengue NS1 antigen, we're looking for the NS1 antigen, okay? So these gold colloidal nanoparticles, these will bind to the antigens, okay? these NS1 antigens, and then they will flow through here. They will flow through by a process called as capillary action. You guys already know about capillary action, capillary tube action, right? So they will flow through here, and these are coated by the colloidal gold nanoparticles. As they come through here, they will meet up at the test line. Okay, this test line contains antibodies specific to those antigens that we are trying to find. What is an antigen? What is an antigen? Speak loudly. What is an antigen? No. What is the definition of an antigen? You guys are learning about antigen, antibody, antigen, antibody. What is an antigen? Can you tell me, Shubhankar? What is an antigen?
Anything that causes immune system.
Very good. Antigen is any foreign substance or anything, literally anything that can elicit a immune response. So what is an antibody? अच्छा हाँ, इसका घर कहाँ है? इसका घर मेरे बाजू में है. मेरा घर कहाँ है? इसके बाजू में है. दोनों का घर कहाँ है? आजू बाजू में. हाँ, ऐसे हो जाएगा ना? नहीं, ऐसा नहीं बोला. ठीक है, एंटीबॉडी. ठीक है, तुम्हारा आंसर ठीक है, लेकिन थोड़ा सा ऐड करना होगा. ठीक है, उसको बोलना है कि एंटीबॉडीज आर द इम्यूनोग्लोबुलिन्स प्रोड्यूस्ड बाय बी सेल्स इन रिस्पॉन्स टू ए immune response. Okay, so the test line contains antibodies specific to the antigen that we are trying to find here. If it's an NS1 antigen we are trying to find, then it will contain antibodies specific to the NS1 antigen. Okay, so we have put our sample here. After that they get bound to the colloidal gold nanoparticles, and then they come here, meet up at the test line. If the antigens are present, then this will react with our test line and it will give off a color. Okay, after that will the flow stop? No, the flow will still go there, and it will meet up at the control line. Okay, what is a control? What is the use of a control? Why do we need to compare to make sure that the test is okay? All right, so the control line actually contains antibodies against these colloidal gold particles. Okay, so as the colloidal gold particles, they actually bind with everything, irrespective of if it is our target antigen or not. So after the target antigen has been bound here, the rest of the colloidal gold particles and other things will flow, meet up at the control line. As the control line has antibodies specifically against these colloidal particles, this will react and it will give off the control line. Okay, so if the control line is not present here, it means that there is some issue with the flow of the what? Serum or our test sample, right? So the control line is a must for having. Okay, so if you can look at your things now, those rapid test kits, you can see that there is something called as a S. For example, in her there is nothing called S. S is where you put the sample. Okay, this is where you put the sample. Okay, after that you can see that there is something called as C. C is the control line. Okay, then we have the T. T is the test line that should come. In some of the cases, for example, the one with Mr. Modi here. Okay, see. Now you can see that there are particular names written here. Okay, this is the rapid test for syphilis. This is a rapid test for HIV. In case of HIV, you can see that there is a C, 2 and 1. So what are the 2 and 1? Is the first HIV, is the second HIV, I am first. Yay. No. if you tell patient, you come second. Shit, yeah. I was always first man. No. This is HIV type 1, this is HIV type 2. Okay. So if you can look at this one, this is for dengue. Okay, but dengue. Okay. In case of dengue, we have the NS1, we've got the IgM, and we've got the IgG. Between IgM or IgG, which one comes first? IgM comes in acute reactions, acute infections. Okay. So in case of dengue, within the first 7 days, within the first 6 days, there will be dengue NS1 can be detected. After around 6 to 10 days, we can detect the IgG. After like 14 to 16 days, we can detect the IgM, then we can detect the IgG. Okay. So can you see that there is a control and a test? But here we can see there is a extra thing called as a B. What is B? B is a buffer. Okay. Sometimes the serum might not be enough. There might not be enough liquid in the serum to push it all the way through the control. Okay. So sometimes we have to put in some extra buffered liquids. These don't do anything except just push our serum towards the end of the sample. Okay, you can see that there is a G written here. This is IgG1. This is M written here. Now tell me something. If say for example the patient, there was a line at G and line at C. What does this mean? It means IgG. It's a chronic case. Okay. For example, if let's say there is a line at T, but there is no line at C. What does this mean? Test is invalid. Okay. The control must come. Even if you put in some water drops here, the control will show, because it will flow. The gold nanoparticles will flow, and to react at the control side. Okay. So you guys have an idea, right? You guys have any questions? This is a lateral flow because it is flowing laterally. You can see one example here. Okay. Can you guys tell me what is the diagnosis here? For the tall guys at the back. कोई नहीं, इधर आजा, देख ले। हाँ ठीक है देख, कोई दिक्कत नहीं है। देखा सबने? विवासन देख ले, देखा ना? तुमने देखा? क्या लग रहा है डायग्नोसिस क्या हो सकता है? ये सिफिलिस पॉजिटिव है, ठीक है। ये सिफिलिस H2O H1 मतलब HIV1 HIV2, फर्स्ट नहीं सेकंड नहीं, ठीक है। HIV1 2, हाँ फर्स्ट नहीं आया यार, सेकंड भी नहीं हुआ सर, क्या है दे दिया मेरे को, ठीक है, ऐसा नहीं है। अच्छा एक और चीज़ है, दिस वन, दिस आर कॉल्ड द कैसेट्स, ओके, एंड दिस इज a strip. This also works similarly, except that in case of cassettes, we have to put the sample here. Na? In case of strips, we'll just dip this part inside the sample and then we'll keep it, and the mechanism is almost same. Okay, this will flow through here. This is our control line, our test line will be here, and we can see if it's a positive or not. For example, can you see this one? This is a positive for syphilis. It's a very thin line. But even if it's very thin, if you can visualize that there is something there, it means it's a positive one. Okay. Then finally, if you look behind you, this is called the flow through. Okay. The first one is the lateral flow. Okay. This one is the flow through. Flow through means it is flowing through our cassette, right? The lateral flow used to flow laterally. This one will flow from top to the bottom vertically. Okay. So what will you do? Can you see here? Which is my pointer? Okay. There is something called it's very difficult to make out. It's HIV1 written here. HIV2 is written here. There is control on the top. And there is P24. Okay, P24 is another specific antigen. Okay. And there is HIV1, HIV2. What we do, we put in the sample. Okay. We put in the sample, and after that we have to add a buffer. Why you have to add a buffer? So that it drips to the down, drips to the bottom. Okay. After that we will be adding a protein A conjugate. This protein A conjugate will do the similar work as that of the gold nanoparticles. Okay. This will bind to the FC portion of the HIV. Which is the FC portion? This part. Okay. These portions are called F, AB portions. Okay. This is the FC portion. Okay. The protein A will bind to the FC portion, and finally it will give off a color. Okay. Now based on the color we can tell if it's HIV1 positive, 2 positive, or if both of these are positive. Okay. So this thing will come up as dots. Okay. I will show you the dots. Okay. There will be one dot at the control, one dot at the HIV. If the patient has only HIV1, it might have 2 dots, both at HIV1 and 2, and another at control. So this is how you tell. Okay. If you guys can come over here, I can show you the test sample. Okay. This one has a control on the top. There is T1 here and there is T2. Okay. Can you guys appreciate that there is a blue colored dot here? There is another small dot on the T2 part. And there is a very faint looking dot at the T1. Can you see? Can you see? देखो हाँ चलो देखो कोई दिक्कत नहीं सर. Can you see this one? Can you appreciate the faint dot? Okay. Can you appreciate the faint dot? अबे देखो ना पहले. ठीक है, कोई दिक्कत नहीं. Can you appreciate the faint dot? Okay, very good. So what is the diagnosis in this case? We tell it as reactive. Okay, we never tell the patient as positive because positive has a bad connotation to it. If you tell reactive, if it's a layman, possibly they should not know about this. Okay, if you tell it's a positive, they will HIV positive. Khatam chalo. Okay, so it's reactive for both 1 and 2. Okay, so if the control was not there, what will be your interpretation? Invalid. If the T1 was there, control was there, but no T2, only T1. If T1 is there, T2 is there, no control, invalid. Very good. Khatam chalo.
Good evening, everyone. So we'll learn about ELISA. What is ELISA? What? Enzyme-linked immunosorbent assay. Okay, what does it mean? एंजाइम है, इम्यून का कुछ होगा. Enzymes are studied, no? Okay. We'll ask you questions. Okay, so ELISA was first developed by Peter Perlman, Eva Evangel. Okay, you know the names, study the names. I hope they don't come in your exam. Also, what is ELISA? It is to detect and quantify the presence of antigen or antibody. Detection though you can do with your rapid tests also. So what is the significance of ELISA especially? You can quantify it. Okay. What specimen can be used? What specimens can be used? Yes, what, sir? Yes, good, very good. Okay. We'll use an enzyme, a substrate, a chromogen. As sir said, we'll use an enzyme, a substrate, and a chromogen. And how the name comes, I'll tell you in the next slide, okay? So it works on the principle of immunosorbent, enzyme-linked conjugate, and substrate-chromogen system, okay? What is immunosorbent? Who took my ELISA plate? Okay. Immunosorbent matlab these are polystyrene microtiter plates, okay? Microtiter wells or microtiter plates. There are 96 of them. We are very short of like in our rations, so we'll use only 3, okay? So there are total 96 spaces here. Microtiter plates we use. Immunosorbent matlab these titer plates are able to hold antigens. These can be coated with your antigens, okay? It will provide a solid base for you. Okay, so while detecting, those antibodies or antigens can come and stick to the specific antigens or antibodies that are present on the walls of the microtiter plates. Is it clear? Suppose this is a well, okay? One well is there. It is coated with a specific antibody. It is coated with a specific, antigen. An antigen is there, you pour in the specific antibody, it will go and stick to those antigens. Those antigens are already stuck to the solid surface of this one, and even after you wash it, it will be retained here, and then you can detect. Okay, we'll learn those steps in our next slide. Enzyme-linked conjugate. What is enzyme-linked conjugate? So one component, either the antigen or antibody, will be linked with an enzyme. Is it clear? Here we will use horseradish peroxidase. It's a very big tongue twister for me, okay? Horseradish peroxidase, okay? What it will do, it will reduce the next part, which is a substrate-chromogen system. The substrate-chromogen here we will use our tetramethylbenzidine along with hydrogen peroxide, okay? These will react with the enzyme and it will give you a color change. Is it clear? That color change we will study via photospectrometry and will quantify the amount of antigen or antibody present in the patient serum. बहुत बड़े-बड़े words हो गए क्या? Is it clear? Okay. And thus the name is enzyme linked because we'll use an enzyme which is horseradish peroxidase. Immunosorbent because we use this solid base. Okay, ऐसे का छोड़ दो. Now types of ELISA. What are the types? Direct ELISA, indirect ELISA, sandwich ELISA, MAC ELISA, which we will not study, and competitive ELISA. Okay, the rest 4 we will study today. We'll move on to direct ELISA. In direct ELISA, what is our target? What do we want to find out? लिखा है, पढ़ो. Antigen. So this is what, first of all, this is what these microtiter plates look like. Okay, this is very zoomed in. This is our positive control. You can see the color change is the highest here. These are negative control, no color change. And these are our test samples. Okay. For direct ELISA, our target is the antigen. So consider this one microtiter well. Okay. It will be coated with the patient's test serum containing the antigen. Is it clear? It will be coated with the patient test serum containing the antigen. You can see the antigens are there along with other particles from the serum. Okay, and this is our negative control. Nothing is here. And then we'll add the primary antibody enzyme complex. You can see the antibody here. You can appreciate this like shape of the antibody with the Fab and the Fc sequence. Is it clear? It is conjugated with a HRP. What is HRP again? चलो तुम लोग का tongue twist नहीं होता. It will then, what will happen if you keep one antigen and one antibody together? हाँ हाँ, एक लड़का और लड़की कभी दोस्त नहीं रह सकते. क्या होता है? They will attach, they will bind, and then what we will do? Here he has no one to bind with, single banda. Okay, so next step is washing. So after washing, what will happen to these antibodies? These are already binded to the antigen. Will they wash away? No, but this one, it will wash away, right? Then our next step will be, wash ho gaya, next step will be, we'll add the substrate chromogen. What was our substrate chromogen? H2O2, very chota likha hua hai, H2O2 plus tetramethyl benzidine. Okay, in presence of horseradish peroxidase, the H2O2 will reduce and it will give the color change in presence of the chromogen. Is it clear? Reaction karega abhi. Reaction ho raha hai, and then it will show you a color change. That was the color in the positive control, right? Or the tests you have seen. So it will give you a color change, which we will study via spectrophotometry. We'll study the density of the color change. Is it clear? Next is indirect ELISA. इसमें हम लोग क्या डिटेक्ट करेंगे? हाँ, एक में एंटीजन हो गया, दूसरे में एंटीबॉडी. गुड, वेरी गुड. दैट इज हाउ यू विल रिमेंबर. सो इनडायरेक्ट ELISA में हम लोग एंटीबॉडी डिटेक्ट करेंगे. वी कोट द माइक्रोटाइटर प्लेट्स विथ कौन सा एंटीजन? पेशेंट का. वो तो हम लोगों ने डायरेक्ट में कर लिया. इनडायरेक्ट में क्या करेंगे? These are pre-coated antigen microtiter plates. Okay, these are pre-coated with specific antigens. Suppose you want to find out hepatitis B antibodies present in your serum, so these will be pre-coated with hepatitis B antigens. Is it clear? So these are pre-coated with antigens. Now the test serum will be there. Whatever test serum is there, we will add it. It will contain the primary antibody, which we want to find out if it is present in our serum or not. It will go and attach itself to the antigen. Now, this primary antibody will not contain our enzyme, right? So what do we need to do? What should be the extra step here? What is the definition of an antigen? Abhi sir ne padha hai. Anything that can elicit a immune response. Okay. So now what will happen? Funnily enough, this entire thing will act as an antigen. Okay. And we'll introduce a secondary antibody enzyme complex Is it clear? We'll introduce a secondary, आजा यार, secondary antibody enzyme complex, and it will connect with which part of this primary antibody? हाँ, F इसके बाद, अरे F, A और B इधर कनेक्ट हो गए, बाकी क्या है? हाँ, चलो. It will connect with the FC sequence, okay? And then you will wash it, add the substrate chromogen. Here also you will have a negative control, okay? I mean a control, positive and negative control will be present, okay? We will not show it in every slide. So after washing you will add the substrate chromogen and it will give you a voila, color change, okay? Which will again be detected by spectrophotometry. Good. Next one is, हाँ, किसको सैंडविच पसंद है? अरे हाथ उठाओ क्या यार, तुम लोग को सैंडविच पसंद नहीं है क्या? डिसअपॉइंटेड बर्गर पीपल. अच्छा, व्हाट इज अ सैंडविच?
दो ब्रेड के बीच में.
हाँ देखो, इनको पता है, बाकी को नहीं पता. हाँ, आप रसोई में काम करते हो. तो हाँ, सैंडविच, यू आर करेक्ट. व्हाट इज अ सैंडविच?
Between two breads you have the filling inside.
हाँ, फीलिंग्स है. सैंडविच, दो ब्रेड के बीच में फीलिंग्स है, सो दैट इज अ सैंडविच. सो हियर इज वन ब्रेड, और इट विल कम विद, इट विल बी प्री कोटेड विद द स्पेसिफिक एंटीबॉडी. Okay, I am trying to make it fun because you are all, I am looking at you, you are all sleepy. And then we'll add the test serum. Okay, the test serum will contain the antigen. Okay, what it will do? Antigen, if you introduce into a pre-coated environment which has antibody, it will come and bind. Is it clear? It comes, it binds. Okay. And now we have to do the third step. What is the third step? वो enzyme linked वाला antibody हम लोग को introduce करना होगा. We have come to learn about this thing in the direct and indirect. So we introduce our enzyme labeled जो primary antibody होगा, that will introduce. Okay? बन गया sandwich? Between two breads सर का feeling आ गया? ठीक है, चलो. And then we'll add the substrate chromogen. Substrate chromogen will give the color, and again we'll study with spectrophotometry. Okay, spectrophotometry. क्या? Good. अभी ये क्या है? हाँ, नीट पीजी एलाइसा. चलो. So in this case, in competitive ELISA, our target is either an antigen or an antibody. Is it clear? So suppose in this case we will try to find out a specific antigen is present in a sample or not. So we will, what we will do, we will take the serum, we will introduce it to specific antibodies, we will keep it for overnight. What will happen? Those antigens in the test serum will bind to those specific antibodies, and there will also be free antibodies. ठीक है? Suppose this incubation chamber we put 100, अच्छा 5 ही पकड़ लो, 100 ज़्यादा हो गया, चलो 5 डाल दिया, ठीक है. 5 antibodies are there and the serum only contained 3. So the 3 of those antigens got bound to the 3 antibodies. How many are free? 2. Now what we will do, we will shift this into a microtiter plate. Microtiter plate में which are pre-coated with antigens again. Okay? What will happen? ये जो कपल लोग हैं, ये लोग क्या फिर से बाइंड करेंगे क्या? नहीं करेंगे ना. Who will bind? The free ones. कौन सिंगल बोला रहा इधर? तूने ना? Free antibodies will bind to the pre-coated antigens. Okay? And after binding, ये bind हो गया. We'll do washing. When we'll wash, since these are pre-coated, these antigens are already attached to the this one microtiter plates. Antibodies got attached to these antigens, hence they are also attached to the microtiter plate. Okay, but these free bound antibody antigen complex, what will happen to these after washing? They will wash off. Okay, and then we'll add the secondary. Remember the indirect ELISA? We'll add a secondary enzyme linked antibody, add the substrate chromogen, and it will give you a color. अभी क्वेश्चन है, In direct ELISA, if there were 5 antigens, it will give you a specific color. ज़्यादा होगा तो ज़्यादा color देगा. Is it clear to you? If the amount of antigen is more in direct ELISA, will it give more color or not? Substrate ज़्यादा होगा, chromogen ज़्यादा होगा, ज़्यादा color देगा. But in competitive ELISA, it is completely inverse. Why? I'll show you. Suppose antigen present in the serum was only 1. Okay. Free antibodies कितने हो गए? 4. Free antibodies जाके bound हो गए इधर. जो extra जो already bound antibody antigen था वो निकल गया after washing. 2 की जगह 4 आके bind हो गए यहाँ पे. 4 के लिए substrate अलग हो गए. मतलब instead of 2, we now have 4 substrate chromogen complex here. Okay? ज़्यादा reduce हो रहा है, ज़्यादा color produce हो रहा है. So for 1 antigen, the color is more than we had for 3. Is it inverse or not? So that is the difference between competitive and direct ELISA. Okay? Direct, indirect, sandwich, and then competitive, it's inversely proportional. Okay? Now suppose even numbers. Okay? Here every antigen is bound to the antibody. You introduce it into the microtiter wells. It does not bind to the pre-coated antigens. You wash it off. Here it will not give any color. So here we had the highest number of antigen present in the patient serum, but we did not get any result. But in case of 1 antigen present here, we found that the intensity of the color was much more. Okay? While in case of direct ELISA, what did we find? If there was 1 antigen, it will be less color. If there were 5 antigens, it will be more color. I am only talking to you 1 and 5. It is not like that. Okay? So, next we will study about the advantages and disadvantages of ELISA. ELISA is a choice of detection in large laboratories. Okay, click a photo of this one. It is done in large laboratories. Okay, why? Rapid. 2-3 घंटा लगता है भाई. Multiple samples. The patient load is higher. Hence, the cost of doing the ELISA is divided. It's less, way lesser. Okay. It will take you 2-3 hours. For suppose here are 96, right? So 2 control में चला गया. You can do 94 patients here. Is it not? You can do 94 patients easily. और 94 patients तो होते ही है big laboratories में. Okay. So for 96 patients, you can for 2 to 3 hours is economical and it's relatively fast. Okay. But suppose you are in a PHC. First of all, you will not have ELISA there. But even if suppose you consider there is an ELISA, what will happen? There will be lesser amount of patient load, so it will ultimately cost them more, the people more. Okay. In small laboratories, therefore, rapid tests are preferred. Is it clear? चलो बाकी तुम पढ़ लेना खुद से. Applications, I have already given you the hepatitis B example. Okay. It can also be used for detection of hepatitis B, C, HIV, dengue, EBV, HSV. EBV, HSV का full form बताओ. हाँ EBV, हाँ बताओ. HSV तो simple है. बोल दिया, simple भी बोल दिया. हाँ, good. EBV? ये बोला वायरस. और कुछ? नहीं, ट्राई करो, गलती हो सकता है, कुछ नहीं है, सीखो कैसे. EBV is ChatGPT, what is EBV? Epstein-Barr virus, okay? So now that you have studied ELISA, suppose this is a direct ELISA. Okay, this is our positive control, this is our negative control. These are 6 test samples that are given to you. Okay. Can you determine which might be positive, might be negative? Without photospectrometry, can you do that? but you can tell now by the intensity if the amount of antigen or antibody is more or less. So ma'am, you tell me, do you think this is positive or negative? बैठ के बताओ. हाँ, negative. Relatively, you can assume that it is negative. You will not say completely. Okay, there might be antibodies present, but it did not elicit enough color. Okay, so what you will say, it is, you can assume that it might be positive. 4 और 5 क्या लग रहा है? हाँ, है 3, हाँ 2 and 1 थोड़ा सस है ना, ऐसा लग रहा है. इट लाइक वीकली पॉजिटिव, अमाउंट ऑफ एंटीजन इज लेस. ओके, दैट इज हाउ ELISA is done. Okay, the change in color only shows the completion of ELISA. Okay, it will not give you a positive or negative result. Okay, you can only do that after spectrophotometry. अच्छा, ठीक है, चलो. हाँ, थैंक यू.